Welcome to the College of Education 10-Minute Research Break, a podcast devoted to highlighting research by Illinois State University's College of Education, faculty, staff, and students. So grab a cup of coffee, get comfortable, and take a break with us.
Hi, I'm Tricia Class. Today I'm talking with April Mustian, professor in the Special Education Department.
April teaches courses in measuring and affecting student academic and social behavior and assessment and planning for individuals with disabilities. The article that we will discuss presents an innovative computer-assisted reciprocal peer tutoring intervention. Welcome, April. Thanks for talking with me.
Thanks for having me.
Could you summarize the research about peer tutoring and the unique approach you and your colleagues chose to address early reading issues for kindergartners?
Absolutely. There's a plethora of peer tutoring research that speaks to its effectiveness across multiple skill areas and with many different populations of students in both age and ability level. Peer tutoring takes many forms, such as class-wide peer tutoring, cross-age peer tutoring, and reciprocal peer tutoring, and all have extensive research to support their effectiveness, especially for students with or at risk for disabilities. The specific approach our research used was with kindergarten students, and our study was reciprocal peer tutoring. There isn't as much peer tutoring research for younger children in the area of reciprocal peer tutoring, and that has to do with students being so young that teachers often fear they may not be able to give the right kind of feedback. Reciprocal peer tutoring is a supplemental instructional approach that gives students additional practice in targeted skill areas. And one component that we added to our reciprocal peer tutoring intervention was the use of embedded audio through PowerPoint computer program. And we did this because struggling learners often lack the ability to give that corrective feedback, and we wanted to be able to provide that for them. So by adding the embedded audio in our study, kindergartners were able to listen to the person being tutored, click on the PowerPoint slide to hear the correct answer, and then make a determination as to whether or not the person being tutored was or was not correct.
And to appreciate the outcomes, listeners really need to understand the training the students receive and the peer-to-peer tutoring sessions. Could you describe the procedures?
Certainly. In this reading reciprocal peer tutoring intervention, the focus was on phonemic awareness. We specifically targeted students' abilities to segment and blend phonemes or sounds in words. Tutoring pairs were formed based on similar performance levels prior to the intervention. I trained each tutoring pair on the role of tutor and tutee and on the steps of the peer tutoring during 2 20-minute training sessions immediately prior to the intervention phase. Each tutor received instruction on good tutoring behaviors. For example, speaking clearly, making eye contact, saying good job, providing praise, etc. And then they also received instruction on the scripted step-by-step tutoring procedures. Training continued until each student could present the content and respond to his or her partner's correct and incorrect responses for 3 consecutive slides. I've conducted a few research studies using peer tutoring, but I'd never worked with students this young, so I knew that training would be a very important and critical piece, and that the tutoring procedures themselves needed to be very simple and age-appropriate for these 5- and 6-year-old children. So each tutoring pair was taught to say simple, specific statements based on picture cues that were displayed on each PowerPoint slide. And I'm going to go through the script just to give you a nice insight into how the tutoring session looked. The tutor would say, "Listen," and then clicked on the picture of a smiley face holding its hand to its ear to play the audio reading of the word. For example, maybe the word was cat. The tutor prompted the tutee, "Say the sounds." After the tutee responded, the tutor then clicked on the image of the separated boxes to play the audio segmentation of the word. For example, k, a, t. If the tutee gave a correct response, i.e. matching to the audio, the tutor provided verbal praise. For example, the tutor would say, "Good job," or "That's correct," and would move on to the next task on the slide. If the tutee was incorrect, the tutor would say, "Try again," and then repeated that step until the tutee provided the correct response. After the tutee correctly segmented the word, the tutor would move to the last step and would say, "Say it fast." The tutee provided an oral response, and the tutor clicked on the image of the joined boxes with the black arrow, and if the tutee gave a correct response, the tutor provided verbal praise and clicked on the next image to transition to the next slide. If the tutee was incorrect, the tutor said try again and then repeated the step until the tutee provided the correct response. So very simple procedures for such young children.
So your research design is a very particular type of single subject design that people should know about.
This study did use a single subject design. Single subject design is a heavily used research approach when working with students with or at risk for disabilities, and that's largely due to such a small population of students. This study did use a multiple probe across students design to evaluate the effects of the peer tutoring program on students' phoneme segmentation fluency. And one of the neat features about the multiple probe design is that you don't have to collect baseline data every single day or continuously. You can actually collect data on an intermittent basis. And this really works well for academic skills where you wouldn't want to collect continuous baseline measures for the fear of practice effects. But another piece of the multiple probe design is that students enter the intervention in stepwise fashion. So one tutoring pair at a time would enter intervention so that we can prove the rigor of the design and be able to really, in a causal way, say that the change in behavior really is due to the intervention and not some other extraneous factor.
And your results were quite compelling. Can you talk about the changes you found from baseline to treatment to maintenance for students' ability to segment sounds? And then also, the second thing you asked them about was their attitude about the tutoring.
Yes, there were 4 students in the study. And first of all, I just want to say that this is probably the most rewarding study that I've ever done just because of the change in performance and how well liked the intervention was by these sweet little kids. But all of the students improved from baseline to intervention. Prior to intervention, all students based on assessment scores were identified as at risk or some risk. And as a result of the intervention, all 4 students moved out of those risk categories. In fact, 3 of the 4 students were actually performing beyond first grade level on their phoneme segmentation fluency. And this was in the spring of their kindergarten year. So they are exceeding grade level expectations. Maintenance data were collected for 3 of the 4 students and all maintained their phoneme segmentation performance after the intervention was removed. And I think that what is just as meaningful is that the students also indicated they really enjoyed getting to use the computer. And even one of them stated that he liked being the teacher. So he liked that tutor role, that leadership role. We also surveyed 5 kindergarten teachers at that school, and all had agreed that providing supplemental instruction in phonemic awareness is extremely important for struggling learners. And they actually indicated that they wanted to use that intervention as a supplemental intervention in their classrooms. So what we provided to them was a CD-ROM of all the PowerPoint slides that we had used in the study, as well as binders of all the materials that we used so that they could replicate this intervention in the future with more students. And that was very, very exciting and had a lot of impact.
And here you talked about how the teachers could replicate it, but how do you want to expand or replicate this study for yourself?
I am actually writing a grant with a colleague right now that will extend this line of research. I think that this research is very timely work, given that Illinois is a state that's trying to create a more sustainable RTI, or response to intervention, system in all their districts and schools. What we're finding when we speak to districts, because I do a lot of consultation in my position here as a higher ed faculty at ISU, what we're finding is that districts feel very comfortable with their Tier 1 core reading programs, but they really struggle to find sufficient interventions in Tiers 2 and 3 for their struggling learners that really target specific skill needs that children have. So the goal is to extend this research and continue working within the context of RTI in a way that will support districts in the surrounding area in Illinois. So we want to replicate this study and actually add a little bit more technology to it. We're looking at creating an iPad or iPhone application that will allow students to work on those same phonemic awareness skills in much the same way as was done in this study. So just adding some more technology, replicating, and really looking at it within the context of Tier 2 or Tier 3 interventions for at-risk children in reading.
Good luck with that. I'm sure today's conversation will encourage others to read your article and see its practical application with young learners.
I hope so. Thank you.
Thank you. The full citation for today's article is Wood, Mustian, and Lowe, 2013. Effects of Supplemental, Computer-Assisted, Reciprocal Peer Tutoring on Kindergartners' Phoneme Segmentation Fluency. Education and Treatment of Children, Volume 36, Number 1, pages 33 to 48. Thank you for listening, and join us for future Research Break podcasts.
This podcast is sponsored by Illinois State University's College of Education, where we strive to assure that all students realize the democratic ideal through our teaching, research, and service to the field of education.